Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi, everyone. Thank you for joining us today. I'm super excited to have Dr. Dorette Noorhasan here from Dallas. Dr. Noorhasan, thank you for joining us today. For people who don't know you, I want to make sure that everyone knows who you are. So I want to read a little bit about you for those of you who are joining us. So Dr. Dorette Noorhasan is the medical director and co-founder of CCRM. CCRM is one of the most famous and well-respected fertility clinics in the world. Dallas, Fort Worth. She's board certified as a reproductive endocrinologist and infertility specialist, so she is an expert in how to make babies. She grew up in the U.S. Virgin Islands, graduated summa cum laude from the University of the Virgin Islands, and attended medical school at BU, Boston University School of Medicine. While in medical school, she did medical missions to Guatemala and Mexico. And we're going to speak Spanish today together a little bit. I'm just kidding. No one wants to hear me speak Spanish. After med school, she went to do her OBGYN residency at the University of Texas, Houston, and her fertility fellowship at New Jersey Medical School. She's very well published, has written 2 books, and we're going to talk more. Thank you, Dorette, for being on today's show. I really appreciate you being here.
Thank you for having me today.
Absolutely. So just tell me more about yourself. I know I just talked a lot about, a lot of your accomplishments, but just take some time to tell us more as well in your own words.
Yeah, so let me tell you a little bit about just myself personally. So I was born in Guyana in South America. I grew up in the United States Virgin Islands. I started college there at University of the Virgin Islands and then got accepted to early medical school admission program at Boston University School of Medicine, where I completed my medical doctorate degree. And then I loved Boston. It's so nice there, but it's so cold. And when you're, a girl from the islands, it's so hard to live there. So I moved to Houston and did my residency at the University of Texas, Houston. Mm-hmm. And my residency was in obstetrics and gynecology, and subsequently did a fellowship at New Jersey Medical School in reproductive endocrinology and infertility. I've been in private practice now for about 11 years, the last 8 of which has been here in the Dallas-Fort Worth area.
Wow. And then tell me about your practice in Dallas-Fort Worth.
Yeah, so I'm the medical director and practice director here at CCRM Dallas-Fort Worth. We offer comprehensive fertility care to patients here. So basic things like diagnostic testing, semen analysis, histosalpingograms to see if someone's fallopian tubes are open, blood work, ultrasound. We provide all forms of treatment, including from basic treatments like pills such as Clomid or Femara, inseminations where we put the sperm back into the uterus, to more advanced treatments like in vitro fertilization, where the woman takes injectable medications, we remove the eggs, fertilize the eggs with the sperm in a petri dish, and then subsequently put the embryos back into the uterus. We do genetic testing of embryos, so pre-implantation genetic testing and euploidy screening for couples who desire to know if the embryo is euploid before transferring the embryo. So euploid meaning having the correct number of chromosomes. And we also offer fertility preservation, so egg, sperm, and embryo freezing. Back in the day, women had to choose, do I get married and start my family early on, or do I pursue my career, travel the world, and maybe once I find Mr. Right, then have a baby. And, egg freezing now allows women to kind of have both of those options. And so we're certainly excited to bring that option to our patients.
Mm-hmm. Mm-hmm. Yeah, I mean, I tell patients that sometimes you have to choose between the love of a man and the love of a baby, right?
Yeah, exactly. And now you can kind of have both of it.
Exactly.
You're egg freezing early on, and then wait for the right guy later.
Exactly. And I love that you use the word options, because it is certainly about securing options for yourself. So patients can come see you if they're simply fertility curious and just want to learn about their bodies first, right? I mean,
Yeah.
just because they see you doesn't necessarily mean that they have to do treatment, but sometimes doing a check-in with a specialist can kind of show you a roadmap for what you might want to consider for the future.
That's absolutely right. And so I have a lot of patients actually that will just come in for quote unquote testing. They just want a checkup to see if everything's okay. And they don't pursue treatment immediately. And it may be a couple years later before I see them again, or I hear down the road when they send me a birth announcement, hey, by the way, remember me? I got pregnant. So there are patients I see as new patients that, you know, once they're done with the testing, they don't have to come back. They just kind of want to know if things are okay. And you know, as part of the National Infertility Awareness Week, that's great that people just want to have a checkup and say, hey, I just want to make sure things still work and I'm fertile.
Right. And patients don't need a referral from their OBGYN. They can just see you because they want to.
Exactly. Yes.
Right. And I think that's a myth, that people feel like they somehow have to have a struggle or wait 6 months or a year or longer or go through lots of heartbreak before they get to see an expert like yourself.
That's exactly correct. I mean, you can just be curious and just show up, make an appointment, and come and find out if you're fertile. And, you know, one of the good things about doing that, getting the testing and just knowing what your options are initially is if you do need treatment, you're at least are aware of it early on. And there's no harm in a little bit of knowledge about yourself because it helps you to make decisions down the road.
Exactly. So what made you decide to become an OBGYN?
So I decided to become an OBGYN. A lot of it has to do with, you know, certain tragedies in my life and then watching my mom go through her reproductive years. So, you know, you and I were chatting earlier on before this all started, and my family were immigrants, and my mom had 6 children, 4 of which are alive. And I watched her go through several things in her reproductive life. So one of them, she lost a baby who was about 7 months old from just a gastrointestinal bug, something simple and easy that, you know, here in America, it's easily treatable. But just severe nausea, vomiting, diarrhea, and dehydration led to losing a 7-month-old. And I was 5 years old when that happened. And I do remember knowing that I wasn't going to see my sister again. And then my mother's subsequent pregnancy, you know, she was very good about having her prenatal care visits. She showed up for her delivery, and actually her delivery was scheduled on my birthday. And then when she shows up for her delivery, the baby doesn't have a heartbeat anymore. So she had 2 traumatic losses. And then her subsequent pregnancy, which is my brother, she had severe preeclampsia towards the end. And so severe preeclampsia is when women have high blood pressure, they can have protein in their urine, large swelling in their legs, more so than just average swelling associated with pregnancy, multiple electrolyte abnormalities in their bloods, and then could potentially have seizures, lose the pregnancy, or even in very severe cases, lose their whole life. So she had an emergent C-section and certainly tied her tube. She's like, I'm done with this. And when my brother was about 5, my mom passed out in the kitchen from massive bleeding. She knew she had fibroids, but I don't think she knew what fibroids were or how severe they could be. So she eventually got a transfusion and subsequently had a hysterectomy. So just kind of watching her go through her own reproductive life has certainly planted a seed in me that, hey, you know, I want to help women and children. This seems to be my calling in life. But certainly I didn't know anything about being a doctor until I got to medical school. And, you know, I kept an open mind when I was in medical school. We rotate through the various departments of medicine, and, you know, every rotation I loved, and I thought, oh yeah, I'm going to be a pediatrician. I'm going to be a surgeon. I'm going to do internal medicine. But at the end of the day, it boiled down to just OBGYN, a little bit of medicine, a little bit of surgery, and I get to take care of women. And then during my OBGYN residencies, when we rotate through the various subspecialties of OBGYN, so reproductive endocrinology and infertility being one of those subspecialties. And that's when I found my true calling in life. I really enjoy helping people who are struggling to have children, help them fulfill their family dreams. And Well, I have two favorite part of my jobs. The first one is when they first find out that they're pregnant and they come in for that first obstetrical ultrasound. And, they're nervous and, we do the ultrasound and they see the pregnancy, they hear the heartbeat, and it's just, they have such tears of joy, and that's just an amazing moment. And then the other time that I really enjoy my job is, 9 months later, they show up at my office, the front door, and they bring the baby, and I get to take a picture with the baby, and I get to hold the baby, and then I really, I'm sharing in their excitement and their joy, and that happiness, it is very good. It makes me feel like I'm doing good for other people. So I really enjoy doing what I do.
Right. I mean, you're bringing more love into this world. Every patient encounter you have is an opportunity to do that. And now more than ever, that's important. And I'm sure you've seen it as well. This pandemic hasn't necessarily slowed people or stopped people's desire from having children. If anything, it's gotten them more focused on what their priorities are. Have you noticed the same thing?
I've noticed the same thing, yes, with this pandemic. We hear that there's going to be a baby boom in 9 months. But for women or just people in general who are struggling with fertility, they cannot get pregnant the old-fashioned way. So they're not part of this baby boom that, we're going to hear or see in 9 months. And so now they've become particularly focused on their goals too. And so patients do want to get pregnant. They do want to pursue their families.
Right. I want to get into a little bit about the 2 books that you've written. The first book is Miracle Baby, A Fertility Doctor's Fight for Motherhood. Tell us about your book.
Yes, so Miracle Baby, A Fertility Doctor's Fight for Motherhood, it's a memoir of my life story, and it really details a lot of my own personal struggles with infertility and trying to have my son. So earlier on in this interview, you asked me about the types of things I provide to patients, in terms of testing and treatment options. And I can tell you, I've stood in my patient's shoes because I've done pretty much all that testing, all that treatment. I've personally undergone 5 rounds of IVF, 5 egg retrievals. We did genetic testing, the PGTA, of our embryos, and only to have 1 good embryo after all of that. So 1 euploid embryo. And then subsequently that embryo was transferred to a surrogate. And so it's because of my surrogate's kindness that I'm a mother today. So the book, Miracle Baby, it details a lot of my struggles. Now there's 2 parallel stories. So the first story is my struggle to have a child. The second parallel story in that book talks about the tragedies in my life and some of the stuff I watched my mother go through, and also my very humble beginnings to eventually become a successful physician. The book is a book of hope, faith, perseverance, and certainly love. When you read the book, you will cry, and then you'll laugh sometimes. And there'll be moments of hope, and then there'll be moments of severe despair while you're reading this book. But the book ends with you walking away feeling inspired and feeling very happy.
Awesome. And what was your hope or goal in writing the book?
My hope with writing the book was to help other patients. So I am a very private person, and actually putting my life story and my own struggles and, my husband and everyone else who was involved into a book that's now public was something I never thought I would do. I've listened to thousands of people share their problems to me, and I've internalized my own problems and never really talked about them. And so when my surrogate was pregnant and she was a few months before she was due, the opportunity to leave private practice for a little while came about. And, I didn't carry him for 9 months. I didn't really know him. And so I decided I was going to take a break from working and then eventually come back. And when I was getting ready to leave, I started telling patients, hey, I'm leaving. I'm, expecting a baby. And they're looking at me like, you're not expecting a baby. There's no baby there. And of course, then I have to share details. Okay, there's a surrogate involved. She's pregnant. And so I started sharing my story with my own patients, essentially, because they were curious. They wanted to know why was I leaving. And, I have had numerous of my own patients tell me, You're a kind doctor, but now that we know that you've been through what we go through, we have even more respect for you. And this went on with numerous patients. I even had several patients bring me baby gifts. I remember one of them brought me a gift for my child, and I had not helped her as yet have a baby. And I felt weird accepting the gift because, I feel like I haven't given her the gift that she is here to receive.
Right.
And the same thing, she said, your kindness was enough, even though I'm not pregnant as yet. I have hope that I will get pregnant. And so it's my own patients that told me, you have to write a book. You got to share your story with the world. So that's what led me to write the book.
That's awesome. And it's not just one book, there's also a second book as well, the Fertility Manual, Reproductive Options for Your Family.
Yeah, so I wrote a second book. And so what I've noticed over the years, and it's very difficult, you go to the doctor, and especially something like infertility, it can be so abstract, and we're throwing out so much terminology, and it's very difficult sometimes for patients to understand. And so I wanted to write a simple, easy book, not a 1,000-page manual that sat on a shelf, something quick and easy that can just explain the nuts and bolts. What is infertility? How do you know you have infertility? When should you see the doctor? Okay, you went to the doctor. What should you expect that first visit? What should you be looking for? All right, they gave you a list of testing to do. Well, why is it really important that you do all of this test? And then you go back for your regroup or follow-up appointment following the testing, and they give you treatment recommendations. Right. How do you know which recommendation is truly right for you? And then there's a chapter on donor egg, donor sperm, and surrogacy, because sometimes you have to borrow an egg, a sperm, or a uterus in my case.
Right.
And then there's another chapter on recurrent pregnancy loss, because unfortunately there are couples who are getting pregnant, they just cannot hold on to the pregnancy, and so they need help too, having a lot of birth. And then the final chapter talks about the psychosocial aspect of infertility. As you know, our patients, they are very stressed out. They can struggle with anxiety and depression. It can affect the way they interact with their family and friends. So the last chapter explores the psychosocial aspect of fertility. It's interesting. When I wrote this book, I gave it to my husband and had him read the first draft of this book. Yeah. And he said to me, my husband's not a physician. He doesn't come anywhere close to blood or anything that is medical. And so I had him read the first draft, and he said to me, I wish someone gave me this book before we started out our journey. And this is coming from a man who's married to a doctor who can just sit and explain everything to him all the time. But he felt that if he had this book, at least he would have the knowledge that he needed to ask the right questions, because sometimes he didn't even know what the right questions were to ask.
So maybe the book is also for family members, for people who are struggling. So let's say you have a mother or mother-in-law who's not sure what you're going through. You can even get a patient could potentially give their family member a copy of your book so they understand a little bit more about what the patient is going through.
Absolutely, yes. And that also helps the mom or the mother-in-law in terms of being supportive with what they're going through.
Yeah. So how do you think we should make people more aware of infertility so they're not finding out too late when there's a problem?
Back in the day, 20, 40, 60 years ago, people never talked about fertility. It was, we just don't know why we never had a baby. And people were afraid to talk about it. And the biggest thing, and this is particularly important that it's happening this week, Fertility Awareness Week, is we got to talk about it. 1 in 8 people struggle with fertility. So we all know someone who's having problems having a child. And the only way to make it less taboo is for us to talk about it, share our experiences, because we can all help each other.
Yeah, just like you did with your 2 books. So for those of you who are joining the show right now, this is Dr. Dorette Noorhasan. She's a fertility expert at CCRM, Dallas-Fort Worth. And do you have copies of your books on that shelf behind you that you can show us?
Yes, absolutely. Yeah. So let me grab them here. Bring them closer to the camera. So this one is Miracle Baby, A Fertility Doctor's Fight for Motherhood. And that's my personal story. And then this one is the Fertility Manual, reproductive options for your family. And it's just a short, easy, less than 100 pages book of information.
So do you think the experiences that you've had as a patient make you a better fertility doctor, more understanding, more compassionate?
Absolutely. I feel that I have become a good doctor by first being a patient. So yes, it has helped me.
Yeah. What advice do you give men and women who are struggling with infertility?
The biggest advice that I can give men and women struggling with infertility is to seek help. So go see a doctor, and then also, as we talked about, just awareness. Talk to your friends, your family members, join support groups. It's really nice to know that there are other people struggling with the same thing and to bounce your experiences off of each other. That's going to be very, very important. And we're all in this together. Parenthood is a real possibility today.
And the CCRM name, I mean, that means a lot. What does that mean from a lab standpoint for a patient to know? Like, why is the fact that you are medical director of CCRM something that is important?
Yeah, so CCRM has an outstanding lab. We have very high pregnancy success rates. We have our own genetics lab so we don't send out any of our specimens to other genetic labs. The pre-implantation genetic testing, aneuploidy screening that we talked about, it's done by us. So we keep excellent quality control. So it is very important that people know that we will provide good care to them.
Absolutely. Well, thank you for joining me this afternoon. I really appreciate it. I appreciate your time. I appreciate all you're doing for your patients. I love your approach. I love your hands-on, very personalized care that you've described to us today. If there's one thing that you could tell someone who's struggling with fertility, what would that one thing be?
To not lose hope. That's going to be the most important thing, is just have hope. In today's day and age, becoming a parent is a very real possibility.
That's so true. There's so many ways and creative ways. I mean, everyone wants a pregnancy with their own eggs, own sperm, own uterus. But and I'm sure you can relate, I have patients now that I might not even have been able to help 5 years ago, but I can help them today because of how technology has changed. We have more tests that we can do and different approaches to, let's say, implantation testing that we didn't have before.
Yes, absolutely. Absolutely. The technology continues to improve. And 20 years from now, it's going to be it's going to be even better than it is today. So
Really
I don't think people know how much advanced the technology has gotten. And we have lots more still to go, but we can really help people with how outstanding the technology is today.
Absolutely. So for a patient that's out there that, let's say, saw a fertility doctor a year ago and still hasn't achieved the success that they deserve, now is a great time to check in with a local fertility doctor, don't you think? I
absolutely agree. It's now or never. So this is a good time to check in with a local fertility doctor and find out what are your options, because it's very possible now to have a baby.
Right. Well, I'm going to post the links to your 2 books so people out there who want to read more about you and learn from or send a copy of the reproductive options book to a family member or friend, I'll make sure that I make it so that it's easy for people to find and share it and buy it. So thank you so much for all your work. Thank you for your passion projects and the 2 books. It was wonderful talking to you today, and I hope you have a great rest of your week.
You too. Thank you.
Thanks,
Patty. Bye.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.